Hi, everybody, and welcome back to the AIAMC podcast. I'm Dr. Diana Singer. I am a proud member of the board of directors for the AIAMC, and I am thrilled to be here with two extraordinary women today to hear about their experiences with the AIAMC and particularly their service to the board. So, joining us today, we have Dr. Reham Shaaban. She's a clinical professor of medicine and chief academic officer and program director for internal medicine and also is an AIAMC board member. Her term is sadly coming to an end here in March, so get to hear about her experiences over the last few years. And Dr. Kathy Zoppi, who is an assistant DIO, GME clinical professor in family medicine at the Indiana University School of Medicine, and a newly appointed secretary and treasurer for the board, as well as our 2026 annual meeting chair. So, Reham, I'm going to start with you. So, yes, I'm very sad that your term is ending here on the board. Tell us a little bit first before we really dive in. How did you get involved with AIAMC? How long have you been on the board? And what has been the most fulfilling aspect of being on the board?
Yeah, absolutely. Thank you for asking that. And I'm very sad as well. I actually didn't realize my term was ending until Kimberly told me that it is. And I was like, really? Already? So how I got involved with the AIMC actually was very early on as an academic faculty. My program director, who was very involved with AIAMC, wanted me to develop a QI curriculum for the residency. And I said, I don't know anything about QI. You're asking the wrong person. And he looked at me and he said, no, I'm asking the right person. You're just not asking me back the right question. And I was like, what is that? And he said, the right question to ask me is, if you want me to do this, how are you going to support my professional development to build the skills? And I said, oh, so how are you going to do that? And he's like, first, you need to join this organization because they're great and they're very dedicated to professional development, quality improvement, patient safety, engaging learners and leaders across the organization. And he took me with him to the first meeting, and I was hooked. And that was a long time ago. I don't even know. That was probably late 2000s.
Wow. And then tell us your journey to get onto the board.
So I think that since that meeting, I've probably attended every annual meeting and became involved with, annual meeting planning committees and, different subcommittees reviewing, posters and workshops and connecting with different members. And the more people I met, the more I wanted to know how they think and how they approach what they do. AIMC has felt like home with similar thought leaders and people that shared in the same vision and mission of their careers and kind of medical education bringing us all together. And so I think there was that hunger of like, I want to see what happens at the table. I want to see like behind those closed doors how the decisions are made and how people think. And I think the unique aspect of being on the board is that you get to work alongside with some of these leaders that don't just represent one institution, but with a variety of experiences and all coming together for the sake of this organization from different perspectives. And so for me, it wasn't just a professional opportunity, it was a learning opportunity as well.
I love that. I think so many of us share that kind of. I came to one meeting and I was hooked. And
Mhm.
whenever I'm trying to describe AIMC, it's so different so than some of the other national organizations that we're all part of that are, wonderful but large. And
Mhm.
I laugh at some of those bigger meetings. It seems like our AIMC colleagues, we tend to congregate together and say, we can't wait for our own meeting. It's more like a family reunion, is often how I describe it. So I definitely resonate with that. Why would you encourage? So let's say there's somebody that comes to our annual meeting this year and it's their first time and they get hooked. So why would you encourage them to get involved with AIMC? What would you say would be your recommendations and kind of next steps?
So I think that there's a lot of advantages of being involved with AIAMC. And, for me, one of the biggest advantages, honestly, was to feel connected to that family that you were talking about. And a lot of times within medical education, within leadership, you do feel alone. And I think, looking to someone for advice that you know is not going to judge you or, sign your paycheck or your performance review when you're like, I don't know how to do this or I'm having this problem. So the AIMC became more of kind of my own personal advisory board where I can reach out to Kathy or reach out to JP or to you to be like, what do you do with this or how do you handle this? And so it's it's a professional home. I think that's what I would say. And I think for people that are looking for careers and advancement within medical education and who really want to do this right, you have to have that personal board of directors in a way to help guide you.
I love that. It's such a great description. So this might be a hard question then to reflect on everything you just said and all those years. So what is a favorite AIAMC memory and why is it meaningful to you?
So I have a very vivid memory actually of I think it was the last meeting that Ethel Weinberg was at. So Ethel Weinberg was one of the founders for AIMC, and she was at Bay State Medical Center where I had trained and previously worked. So it was Ethel Weinberg, it was Bob Ficalora, Kevin Hinchy, myself, and one of my residents. So it was 5 generations of program leadership all together at this meeting. And we took a picture together because we're like, we have to capture this. And AIMC brought us together.
Oh, that's incredible. 5 generations. Wow, that's powerful. Really powerful. So, for those of you listening, this is our dynamic duo planning this next upcoming annual meeting coming up in Carlsbad. Gosh, next month already. Maybe time doesn't fly for you guys when you're doing the hard work behind it, but I think we all have a countdown. So, tell me, what are you most looking forward to at the 2026 annual meeting?
For me, well, being a leader with Kathy, developing this has been wonderful. I'm excited for the program. I'm looking forward to not fumble and not stutter. I'm hoping I'm hoping that that does not happen, but I do think it's going to be a very exciting meeting. I think it's going to be energizing, and I love all aspects of it. I think the pre-conference workshop is very exciting for me to be able to talk about kind of shared dilemmas across our institutions. And I think that speaks to my earlier point about this being a professional home where you can go for advice and solutions.
I love that. And definitely feels like coming home for sure.
Mhm.
So, Kathy, I kind of alluded to this earlier. You've been involved in a lot of different national organizations. In your perspective, what makes AIAMC unique?
I started coming to AIMC out of narrowing down of organizations that met the needs where I was. I was a DIO of a small community network that was expanding the number of residency programs we had. We went from 1 to 8 at the time that I was the DIO and chief academic officer, and there was no niche for that work. The ACGME, I think people fear sometimes it's the accrediting body. So is it safe to ask questions there or not is a question. The AAMC had sort of a restriction of how many programs you had to have before you could be in the GRE space. And so I came to AIAMC on my own the first time, just to sort of sniff deeply and see if people were friendly and useful and kind. And of course, I did my usual thing of arriving at the meeting and not knowing anyone and not knowing what I was going to attend. It was a very warm and inviting atmosphere. As Reham has said, people are willing to be your advisor and coach and friend and help you with their experiences without question. So that is a very different atmosphere than some conferences where there may be some standoffishness or posturing. I think that's a real selling point of AIMC. The second year I came, I brought a team and they participated in the national initiative, which was a way for our organization across all the programs to start learning about how to partner with each other across specialties. And for that group, that was a novel experience. They were out of their element, out of their little silos at work. And, we had psychiatry and family medicine and surgery and other places talking to each other, and it was the residents who were creating a network to get a project done. So that was really a critical event. And then just every year, I have grown in my ability to connect and see this group as a network. I think it's Wednesday that we're recording, and already this week I've had 3 phone calls with AIAMC colleagues who have been coaching me. So that isn't a common experience, and it does feel like family.
Yeah, absolutely. I don't think any of us feel like we couldn't pick up the phone and call anybody across the country. And I love that we have such a footprint,
Mhm.
wide and far for sure. So kind of talked earlier about getting behind the scenes of the board. So we want to get behind the scenes of the annual planning committee. And as the co-chairs here, the chair and the vice chair. So what does the planning process look like? I know Kimberly, our illustrious executive director, loves to brag on the efficiency, but I want to hear the gory details of what does it look like for you as the chair leading that, and what would you say to someone who's considering joining the planning committee? I am obviously biased as a member of the planning committee, but let's go a little bit deeper of where do you start? What do those ideas look like?
I think one of the things to know is that Kimberly has a template and moves
Adopted.
us through the template. And that is uh, a very helpful thing for people who have not planned a program before. I've been on a lot of planning committees. This one is efficient because everybody gets on at the same time. Ideas are shared. We refine as the chairs with the executive director, and we move forward pretty quickly. Because it's a volunteer group doing the planning, a lot of the work is the heavy lifting behind the scenes is Kimberly's and Mindy's. But I think the emphasis on collaboration, prioritization, and everybody having a voice at the table is unique to the planning process that I see here. So there's a lot of input from members. It's a small membership in some ways, so it's easier than a large organization, but it also means that there is the opportunity to have influence from every constituency.
Yeah, absolutely. So we heard what one favorite session we're looking forward to is the pre-session. For you, when you look at the agenda and kind of see how all these different pieces come together, what are you most looking forward to at the 2026 annual meeting?
There's a couple of opportunities that I think are useful. The turmoil that is the national landscape for medical education is not to be ignored. But we've had a discussion at the level of the board and the planning committee about not being a downer meeting and really helping people to see solutions as well as problems. And so there are a few sessions that are focused on how you can do this in the setting where financial constraints are occurring or where policies and practices within your group are changing. Or in particular, I think relevant to this audience, when mergers and acquisitions are defining your landscape and you don't know the name of the organization you now belong to. I think that's a real challenge, and it's a real reality for a lot of our members.
Yeah, I absolutely agree. I think you both know my dissertation work was on belonging, and I think that's a key just pillar of AIMC is you can't come to this meeting and not feel like you belong. And I remember my first meeting too, and I was like, I don't know anybody, and who am I going to talk to? And it's like a warm hug of a professional home. So I love that explanation so much. Anything else either one of you want to add of formal AIMC commentary? Because otherwise, I have some personal questions for you.
The board question is one that I think is interesting, and I want to respond to it too, because I think there is this need for new members on the board. The vision of AIMC has changed over the years and continues to change as a professional organization, and we need people with fresh ideas in that board mix. Reham sounds like she thinks she's escaping the process of leadership, but in fact, she's going to be chairing next year's meeting. So she'll still have influence over the program. And I think this is a um, very critical period for AIMC, both in terms of membership, but also in terms of purpose and service to the members, to the organizations that it serves and who belong. So I think we really are encouraging people to consider board membership. If you're not familiar with being on a board, There are some parts that are more exciting than others. The budget discussions are really fun. Um, but I think there's room for a lot of new ideas at the table and ways of doing things, and I would encourage that.
I love that. And if you're listening, consider that your call to action for sure. So, Reham, I'm going to start with you. And Kathy, I'm going to ask you the same question. So, if you unexpectedly had the day off, so pretend we live in a parallel universe, nothing's on fire, everything's taken care of in the hospital, everybody's behaving. Like I said, parallel universe, come work with me here. So, everything in the hospital is totally under control. So, what would you spend the day doing?
I would probably check myself into some spa retreat with no phones and spend the entire day there just doing nothing and getting spa treatment and maybe reading a book by a pool somewhere. But I think I would have to check my phone in at the desk and not have it with me,
I love that. So going off the grid for
completely
sure.
off the grid.
Yes, I think
Self-care.
self-care looks like going off the grid right now for sure. Kathy, what about you?
Yeah, mine is I like her answer. I might take it up
We'll go
as
together.
advice. Yeah. Um, but I tend to like to be when the weather cooperates being outside. And so hiking with my dog who would go anywhere, anytime in the car. And rowing, I row with a group, and sometimes it's fun to row by yourself, and sometimes it's fun to row with others. So I would do that if the weather was cooperative. It hasn't been yet, but it will be soon. And I like the idea of sitting and reading a book as though there were time to do so. And I think, doing it in bed with the book falling on yourself as you fall asleep is less rewarding. So I'm a fan of that.
I love that. You're so outdoorsy. I'm here in Texas, so our time of outdoorsiness is limited right now, actually. March is beautiful. Don't come visit in July. So perfect lead into my last rapid fire question for you. All-time favorite book. So Reham,
Ooh, The Alchemist.
The Alchemist, and Kathy.
Whoa. I don't know that I have
We'll
one.
turn around. You've got
Okay,
plenty
yeah,
of
thank
options.
you. It's not, no offense, the Handbook of Assessment. I have really enjoyed Robertson Davies novels, which are sort of old Canadian fantasy, pre Lord of the Rings. Well, I don't know if it's pre or not, but some fantastical things that feel like dreams. That would be my choice now.
I love it. Fantastical. Let's end with that. Let's make every day fantastical. That's just one
Love
of
that. It's my new word for the week.
Yes,
Fantastic.
it's happening. Might be on a matching t-shirt if you know me at all. So with that, our sincere thanks to Dr. Shaaban and Dr. Zoppi. I can't wait to see you guys in just a little bit over a month. And to our viewers and listeners, we hope you'll check out our other AIMC podcasts on our YouTube channel. Be sure to follow us on Facebook, LinkedIn, and Instagram. And like I said, can't wait to see so many of you in California in just a few weeks. So everyone take good care.
Thanks, Dan.
Diana.